Okay, Assalamualaikum and a very good day. Okay, today we'll cover topic on histopathology of GIT, gastrointestinal system. Okay. Okay, what is GIT? Gastrointestinal system. Okay, GIT system is the route through which the foods enter the body. Okay, normal young healthy adult consumes 1 kilo of solid diet and 1 to 2 liter of liquid diet every day. The food consumed cannot be utilized by the body directly. Tak boleh makan terus lah. The process of conversion of complex food substances into simple food substances that can be absorbed by the body is known as what? Okay. Okay, GI tract starts from mouth, goes to pharynx, esophagus, stomach, perut, small intestine, usus kecil, and large intestine. Okay. Okay, what is accessory organs? Okay, accessory organs ni macam teeth, gigi, tongue, lagi apa? Salivary gland, exocrine, pancreas, liver and gallbladder. Accessory ni dia helping in digesting the food, digesting and helping the food to be swallowed and go through the GIT. Okay, like teeth function to make the food become smaller, while the tongue will help the food to go inside the pharynx. Salivary gland, exocrine is responsible for enzyme secretions. Okay. Okay. What is component of a GIT system? As you can see here, can be classified into upper GIT, lower GIT, liver, gallbladder, pancreas, and appendix. Appendix ni lah. Here appendix. This is here appendix. Okay, upper GIT we have mouth, tongue, pharynx, esophagus. Lower GIT is here. Lower GIT is here. Large intestine, small intestine, stomach, pancreas. Large pancreas. The leaf look like shape, and gallbladder and liver. Okay. Okay, now we go to the histology of esophagus. The upper GIT esophagus, just after the mouth, after the pharynx, mouth, pharynx. After pharynx, here we got esophagus. Okay, this is the histology of stomach. Inside the stomach, we got the columnar epithelium cells. That's responsible for absorption. Okay, like this. Okay, got lymphoid follicle, stomach. It is the lining of the stomach, so to be like this. And now we move to the histology of small intestine. Differences, it got microvilli. On the top is columnar epithelial cells and goblet cells. Goblet cells function in secretion. Secrets excretion. Okay. Okay, this is a villi, microvilli is the intestinal gland, therefore duodenum. Okay, Brunner's gland. Brunner's glands exist in the submucosa, and muscular. Okay, histology of the colon. Colon is the last part for absorption. You got mucosa here for in the area of mucosa. You got submucosa and cartilage, and muscle here. Okay. Okay, now we move the pathology of each of parts of the GIT. Okay, each part of the GIT. Esophagus. And now you go first is esophagus. So the where is esophagus? Esophagus is just after the pharynx, mouth, pharynx, and esophagus. Okay. Okay. Esophagus, food tube to transport food from the mouth to the stomach. Ni. The keyword is food tube. It's like a pipe from our mouth, from the mouth to the stomach. It's the food tube. Okay. Synchronized peristaltic contractions follow each swallow to accomplish the task. Meaning that the esophagus will have a contraction and dilation, peristaltic order to make sure the food go down smoothly from the mouth to the stomach. Okay. Lower esophagus sphincter, muscle that separate esophagus from the stomach. Okay, is to prevent contents in the stomach from backing up into the esophagus, meaning that once the food go through the esophagus into the stomach, the function of this sphincter to make sure that food not getting back into the esophagus, prevent contents stomach from backing up into the esophagus. It's like a valve mechanism. Okay. Difficulty of swallowing liquids or solids, heartburn, regurgitation, and atypical chest pain may be symptom of an esophageal motility disorder. Okay, faham Simple je. Difficulty swallowing. Okay, first we got this all happen in the area of upper GIT in the esophagus. Okay, first we have gastroesophageal reflux disease, or we call it as a GERD. GERD. Okay, return of the stomach's contents back up into the esophagus. Back up into the esophagus, meaning that the sphincter muscle is not working well, so the foods that are already in the stomach is coming back into the esophagus from the stomach. Okay, what is the primary symptom? Heartburn, maybe occurs 2 or more times per week. It's a chronic disease. It happens in a long due time, but once it begins, it usually is a lifelong. Okay, GERD may damage the lining of the esophagus, thereby causing inflammation. Damage the lining of esophagus, meaning that all the content, not all the contents from the stomach, maybe having acid, is coming back to the esophagus and may cause damage to the lining of the esophagus. Okay, see the pathophysiology of GERD. Okay, when you swallow food and liquids, they ordinarily pass down the esophagus and into the stomach, staying in the stomach. Supposed to be staying in the stomach from here. Okay, esophagus from here, they got this between esophagus and stomach got a muscle, we call it a sphincter muscle here. Once the food inside here, the sphincter muscle will close, so all the foods already inside here will not go back into the esophagus. So that's the function of the sphincter muscle here. But in this GERD disease, the muscles not working well, making that the food will coming back into the esophagus like this, allowing acid reflux. In the stomach, we have the stomach consists of acid that helps in the food digestion. But when the foods are having a reflux or backing up to the esophagus, so the content of the acid may damage the lining of the esophagus. Okay, when food refluxes back up into the esophagus, there is a burning sensation known as heartburn because the acid contents of the stomach inflame the lower esophagus. Okay, when this process occurs over months to years, the epithelium of the lower esophagus adapts by transforming itself from squamous to columnar. Okay, supposed to be the lining of the esophagus, the epithelium is squamous. But after a year, years to years, the lining, the cells will transform, will adapt to become columnar, like the lining of the stomach. Okay, this type transformation in epithelium is known as metaplasia. Okay, histopathology of GERD. In this biopsy, H&E biopsy, the lower esophagus, the normal non-keratinizing squamous epithelium at the right has been replaced. Ini normal Okay, ini normal in the esophagus, has been replaced by columnar epithelium lining glands similar to what would be seen in the stomach. True, it is not normal because columnar cells are present macam ni. Okay, this is the normal esophagus, but this is the lining of esophagus that has damaged because of the GERD. The epithelium cell already converted, become columnar cells with all the goblet cell here, goblet cell. This is the lining, this is the shape of columnar epithelium cell. Okay, in GERD, lower esophagus adapts by transforming itself from squamous to columnar. This type of transformation called as metaplasia. Okay, next, dysphagia, still in the upper GIT. Dysphagia meaning ineffective of swallowing, inefficient in swallowing. Okay, occurs when the muscles of the tongue and neck that push the food into the esophagus are not working properly. This is the keyword, not working. The esophagus got supposed to be got peristaltic movement, but it's not working properly because maybe a stroke or disease affecting nerve or muscle. Maybe stroke, nerve, damage of nerve that affect the muscles to working well. Okay, dysphagia can cause food to back up in the esophagus. The symptoms: heartburn, regurgitation of food and liquids, sometimes accompanied with blood. Okay, dysphagia tends to become progressively worse over time and to involve both fluids and solids. Some people may also experience coughing when lying in horizontal position. When lying, baring lah, baring menatap, horizontal position. Symptoms: vomiting, something's getting stuck, sensation of pain. Okay. Now we move to the pathophysio, how dysphagia is happen. There are two forms of dysphagia which can affect a person. Okay, first is esophageal dysplasia. Is a form of dysphagia in which the individual experiences a sensation of the food getting stuck in the throat. Macam ni lah. Since the muscle is not working properly, the peristaltic movement cannot occur, so food cannot go smoothly from esophagus to stomach. So the patient will feel like the food stuck inside the esophagus. Okay, next is oropharyngeal dysphagia. The muscle of the throat become weak, thus making it difficult for the food to move from the throat to the stomach. Okay. Okay, next. Symptoms: choking, coughing, having a weak soft voice, excessive saliva, difficulty in chewing, trouble of moving food to the back of your mouth, or sticking on the throat. Basically, you all akan rasa makanan tu tak turun bawah lah. Masuk banyak-banyak tapi tersangkut kat tekak. Macam itulah. Okay, next is achalasia, still at the upper of GIT, in the esophagus. Complete lack of peristalsis within the body of the esophagus. It is a rare disorder that makes it difficult for food and liquid to pass into your stomach. Okay, 50% of people with achalasia will lose weight. Untung ni nak terus ni senang. Okay, the cause of achalasia is unknown. However, there are theories on causation involve infection, heredity of an abnormality of the immune system that cause the body itself to damage the esophagus. Faham tak ni? Maksud dia, the patient may have autoimmune disease, meaning that the white blood cell, the defense mechanism of the body attack the cells in the esophagus, attack cells in the esophagus, making that the cells and the muscle cells in the esophagus cannot working for it works for peristalsis. Okay. Okay, there is no cure for echinacea, but the treatment still there. Okay, like this. Okay, normal patient, they will have a postganglionic fiber that function in neuron transfer, but in achalasia patient, there is no postganglionic fiber. This may cause from the autoimmune disease. The body system, the mechanism body system attack this and destroy this postganglionic fiber. So the neuron, the what we call the neuron, the instruction that transfer from brain cannot be transferred to the muscle that function for peristalsis in the esophagus. So when there is no instruction, no neuron transfer to muscle to do the work, so the muscle cannot perform the peristalsis works and leads to achalasia. Okay, this is a histopathology of achalasia. Achalasia results from the degeneration of neurons in the esophageal wall. Histologic examination reveals decreased numbers of neurons. Okay, the ganglion cells that remains often are surrounded by lymphocyte and less prominent by eosinophil. Kenapa surrounded by lymphocyte? Sebab dia ada autoimmune. Lymphocytes is responsible in what we call defense mechanism. But when patients having autoimmune disease, all these defense mechanisms, lymphocyte, eosinophil, will attack the patient cells, the own cells. That way we call it as autoimmune. Okay, this lymphocyte will attack these ganglion cells. Okay, the blue color is all the lymphocytes. Okay, now we move to next disorder at the stomach. Okay, stomach is at the lower part of GIT. Just before, we already covered on upper GIT, which is esophagus. Okay. Okay, first is gastritis. Okay, gastritis is an inflammation, irritation of the lining of the stomach. Can occur suddenly, acute, or gradually. Okay, meaning of acute is happen suddenly, gradually. While chronic is happen gradually over a time. A long time period, it can be happen. If it tiba-tiba, suddenly happen, we call it as acute. It may caused by Helicobacter pylori, bile reflux, and infections. Okay, the common symptoms includes a nausea, abdominal bloating, abdominal pain, vomiting, indigestion, burning or gnawing feelings in the stomach between meals or at night. And most of all, loss of appetite and can become kurus lah. Okay. Okay, classification of gastritis. Okay, acute gastritis and chronic gastritis. Okay, acute tadi apa? Happen suddenly. Chronic happen over time period. Okay, acute gastritis is the classification is a superficial loss of gastric mucosal tissue, not extending beyond muscularis mucosa, associated with acute inflammation and are transient. Okay, while chronic gastritis can be classified into four major groups: chronic type A gastritis, autoimmune gastritis, and autoantibodies to peripheral cells in the body of stomach, chronic type B gastritis caused by H. pylori gastritis, bacterial infection, and most common cause of chronic gastritis affecting the antrum. Okay, hypertrophic gastritis. Okay, gastric mucosa has giant folds. It's an uncommon form of gastritis. Example is nephrotic lymphocytic and granulomatous gastritis. Okay, kalau yang healthy macam ni lah. Kalau yang ada acute atau chronic gastritis, okay, dia ada damage kat sini. Ni from esophagus, in the lining of the stomach is damaged. Okay, might be from the acute gastritis or chronic gastritis. Okay, pathophysiology of gastritis. Okay, if there is a low acid production, we call it as atrophic gastritis. It will cause gastric cancer. If the high acid production, acid in the stomach, we call it an intra-predominant gastritis that will cause peptic ulcer disease. Okay, kalau chronic ni yang cakap tadi lah, over time, it may be caused from the smoking, alcohol consume, Helicobacter pylori ataupun host factors macam autoimmune dan sebagainya. Sebab autoimmune ni takkan happen sudden. Contohlah kira tiga-tiga faktor ni takkan happen acute suddenly. Dia akan berlaku over the time. Okay, histopathology of gastritis, intestinal metaplasia. Ingat metaplasia tu apa? Perubahan daripada bentuk sel yang lain kepada yang lain. Okay, in chronic gastritis, the gastric faviola, the epithelium ni, faviola ni, is replaced by intestinal type of epithelium. Jadi macam ni. Sepatutnya dia macam ni. Dia jadi macam ni. The intestinal epithelium has a goblet cells. Supposed to be, kalau yang normal ni, dia lining dia ni tak ada goblet cells. Tapi bila dia dah berlaku gastritis, dia bertukar menjadi usus kecil punya epithelium cells, ada goblet cells. Okay. Okay, first peptic ulcer disease, PUD. It's a disease forms a painful source for ulcers in the lining of the stomach. Most happen because of an infection in the lining of the small intestine with a type of bacteria called Helicobacter pylori. Common symptoms: gnawing, burning sensation after meals, and sometimes bloating or fullness. Okay, major complications include gastric or duodenal perforation, upper GI, gastrointestinal hemorrhage, structure at the ulcer site, and rarely gastric outlet obstruction. Okay, ini boleh baca Ni kena baca sahaja. Pathophysiology dia. Okay, histopathology of peptic ulcer disease. Okay, normal gastric epithelium at the left, while there is loss of the epithelium over the area of ulceration. This also results from the presence of acid secreted by the mucosa of the stomach. Okay, gastritis versus PUD. Okay, gastritis is the inflammation of the stomach, while an ulcer is the erosion of the surface of the stomach. Ingat dia perbezaan dia. Gastritis is inflammation, while ulcer erosion. Ada macam menghakis lah. Okay, gastritis, the lining of the stomach is red and swollen. Okay, we move lower intestine disorder. Okay, common disorder that affects the large intestine, colon, commonly cause cramping, abdominal pain, bloating, gas, diarrhea, and constipation. It is not inflammatory disorder, does not present an autonomic abnormality, and is not a life-threatening disorder. Okay, the cause may be emotional stress or fear. Food, certain food trigger abnormality of GIT system. Hormones, changes in level during menstruation can trigger irritable bowel syndrome. Okay, ni untuk menstruation perempuan ya. Increase high fiber food intake, increase water intake and consuming small meals can overcome the problem. Avoid caffeine, alcohol or dairy foods. Ni irritable bowel syndrome. Okay, pathophysiology of irritable bowel syndrome. Inilah, tuan jangan stress lah cakap tadi tu. Okay, next is inflammatory bowel syndrome, IBD. Okay, tadi syndrome ni disease. Okay, it represents a group of intestinal disorder that cause prolonged inflammation of the digestive tract, also known as a Crohn's disease. Inflammatory bowel disease can be very painful and disruptive, and in some cases, it may even be life-threatening. The most common symptoms are pain in the abdomen and diarrhea. Okay, include bleeding from the rectum or weight loss, fever. No cure for Crohn's disease. Okay, the pathophysio also can read. Okay, normal mucosa, cantik ni kan, columnar, tak ada goblet cells. Kalau inflammatory, dia punya bentuk dia pun dah berubah. Ada banyak lymphocyte cells ni. Lymphocyte dengan neutrophil. Inflammation is transmural from mucosa to serosa. Intermural inflammatory is largely lymphocytic. Neutrophil may be present of granulomas. Okay, that's all. Thank you.